Hello, I'm Ted Michaels. PDSD, post-traumatic stress disorder, something that's been talked about a lot lately. In a moment, you'll meet a doctor and an employer who will tell you what the warning signs are, what to look for, and most importantly, how you can get help.
Post-traumatic stress disorder, or PTSD, is an illness that arises after people are exposed to traumatic events. So that might be something like being in a car accident, being exposed to workplace violence, having a history of developmental trauma. So as people grow up experiencing traumas in their family or outside of their family. And people go on to develop a symptom cluster that involve things like being easily startled, having nightmares surrounding their experiences, being reminded of the events by other people or other places and finding that very traumatic. But more than that, it can also involve feelings of guilt, it can involve feelings of shame about what happened, an inability to experience positive emotions, an inability to connect with other people.
Predominantly, it's more of the officers, the sworn members, that see more of that human tragedy unfold on our street. But we need to keep in mind that we have 300 civilian members of our service that are exposed to these crisis events at different levels as well.
Well, when someone is exposed to a traumatic incident, the best predictor of whether or not they'll go on to develop PTSD is their level of social connection or level of social support.
Warning signs, looking for changes in behavior, looking for increased alcohol or drug use, looking for the changes in the way that people approach and interact with each other. But I think most important about identifying the warning signals is giving our own people the courage to make sure that when they see these warning signals, that they intervene, that they probe for information. And the biggest issue is once you probe for information and you see that there's something there, have the courage to make the referral. We have to make the referral to get people into the right help. If we look after ourselves, that helps us to better look after our citizens, because better is better on all fronts. Address stigma. Stigma is a community issue. It is not something that is specific just to police or just to any other organization. It's a community issue. The reduction of stigma is important because we need people to know that help is available, how to access that help, and that their confidentiality will be protected.
I think for many mental illnesses, often the most effective treatments are those that combine medications with what we call adjunctive therapy. So things like talk therapy, exercise, exposure to the traumatic event. So for example, by visiting the scene where that event occurred. And what we really offer here at St. Joseph's Health Caire is a very leading, cutting-edge approach where we often combine medication with novel adjunctive treatments, and that combination is often what's most effective.
When we enter into people's personal lives, yes, we're the employer, but we're entering into people's personal lives. Of course, there's going to be pushback, there's going to be resistance. But you mentioned that it is a difficult conversation to have. Isn't it much worse, and isn't it much more difficult if you don't have that conversation? Because if we don't have the conversation and people don't get help, the potential outcome can be tragic.
For more information on Mind Matters, keep listening to 900 CHML and watching on 900CHML.com. And most importantly, if you have any questions at all about mental health issues, contact stjoes.ca/mindmatters.